Chemotherapy covers the treatment of cancer with drugs, and more than likely will use a combination of drugs depending on your lung cancer. Chemotherapy can be used in different ways. It is often used to try to shrink the tumor, to either allow further treatments or to help symptoms such as breathlessness. The number of cycles of chemotherapy you receive will depend on the type of lung cancer you have, how well it responds to the treatment, how well your body copes with any side effects, and the purpose of the chemotherapy. Chemotherapy works on cells throughout the body, but while it targets cancerous cells, it can also kill healthy ones. As the healthy cells repair, there may be side effects, so between each treatment, there will be rest periods creating a cycle of therapy. Before each and every treatment, you'll have your weight monitored and a blood test to check that your blood count has recovered enough to cope with the treatment. You might also be asked to have another chest X-ray or CT scan after a few cycles of treatment to see in more detail how the tumor is responding. The total number of cycles of chemotherapy you receive may be influenced by the results of these scans. The medication itself can be administered in two ways, either via a drip or in tablet form. If chemotherapy is being given as a drip, then a needle will be placed in the back of your hand by the chemotherapy nurse. Depending on the chemotherapy you're being prescribed, it can be given either as an inpatient or outpatient basis. It can either take a few hours to administer or a few days. Again, this depends on the type of drugs being used. Speak to your healthcare professional for details about your specific chemotherapy regime. When you go home, you'll be given medication which will help you cope with some of the possible side effects. If your tumor gets smaller after your first course of chemotherapy and you're coping well with few side effects, your doctor may offer to continue your treatment with more chemotherapy. This is called maintenance therapy. Maintenance therapy is only suitable for some people with certain types of lung cancer. It may help to continue to slow down the growth of your lung cancer and keep the symptoms of your disease under control for longer.
I received chemotherapy. There's various types, but I received, I think, a sort of mild type of chemotherapy.
They hooked me up to the chemotherapy and what have you. Well, it's just like a blood transfusion, you know, to put the needle in and it put a bag up and it takes, I think, 4 hours or something. And then they flush it through and then you have another 4 hours. So you sat there on a drip, you know, in a nice big comfy chair, and they look after you, bringing you drinks and food, and you can have somebody come with you and sit with you and talk to you and that, you know. And after 30 years, me and Susan got to know each other better because, you know, we talked about everything and anything, you know. And she felt better for being with me as well. And after it was done, I got up, come home, got in the car, drove home, nothing. Oh, brilliant, you know. And they said they'd have all these side effects, you know, and you'd feel poorly and all that. Got up the next day and I was okay, no problem. Everything was okay. And then the following day, wham, it hit me. And I say it hit me, I couldn't even get out of bed. Anyway, the following day, on the Sunday, I tried to get up and I couldn't get up again. I was badly, I was being sick, and I hadn't even eaten anything. Everything that I drank, I was just bringing up. And then I started with the diarrhea, which is a well-known side effect. So, and it was just, I was just totally drained.
But it isn't as bad, you know, as what I thought it was going to be. But I still didn't know what the reaction would be. So what I did, virtually all the way through the chemotherapy that I had, I would keep my bedroom light on because I didn't know what to expect. I didn't know if at some point I might get disorientated, bump into something. be sick and not grab a door quick enough. 101 things were going through my mind, what would happen. But the things that did happen to me were quite strange.
Nerve signals as well can get disrupted. I've been sitting in an armchair completely minding my own business, my arm suddenly taken off because, I kid you not, just done a full circuit and then come back down again. Because the nerves of, the nerve signals are being disrupted by the chemo. That's not unusual apparently. And on one celebrated occasion, I was out shopping and my legs stopped working. Just I couldn't feel it. It wasn't responding to signals, so I just leant up against the display, looking nonchalant for about 5 minutes until it came back.
That was one of your comments earlier. It wasn't without humour. The leg just goes on strike.
I have to admit I'm quite vain. And hair loss was a threat.
Well, to be honest, I didn't have a right lot. I haven't got a lot now, but I've ended up with more than what I had before, right? And I did lose my hair. I went, just one day, I started combing it, and a big chunk come out, and I thought, oh, this is no good.
I lost hair on my chest. It grew back again, but in the wrong place, strangely enough. So I don't think chemotherapy has a great memory for where it puts things.
And in the third day, I said I felt better, and I felt like something to eat. And I got up, and I was all right. So I thought, oh, this isn't too bad, And I didn't do too much, and just gradually, it went, And I sort of like got back to how I was before I had it done,
There's nothing to worry about. You've got everything that you need. Just handle it. Head on to the next time for your next session of chemotherapy.
So, here are some things to remember. Side effects of chemotherapy can vary by patient. The most common ones are sickness and nausea. There are powerful anti-sickness drugs which can help reduce sickness in most patients. The type of food that you eat or smell may make you feel worse, so try to vary your diet and eat when you can. Tiredness. This is normal. Although it is important to rest, a small amount of regular exercise will also help reduce your tiredness. Change in bowel patterns, constipation, diarrhea. Talk to your lung cancer nurse and they will give you advice or medication to help with this. Hair loss does not happen with all chemotherapy drugs. If it does, while it is distressing, it is temporary, and your hair will grow back. Infections. It is important to realize that you are at higher risk than normal. If anyone you know has an obvious infection of any kind, it is best to stay away. If you start to show any signs of having an infection, such as a temperature or flu-like symptoms, immediately contact your lung cancer nurse or doctor for advice.